Hi there, and welcome to our discussion today about up-to-date Lexidrugs, tips and tricks by the North Simcoe Muskoka Specialized Geriatric Service Pharmacists. Today, we're going to talk a little bit about what Lexidrug is, how to use it, and finally, how it facilitates BPMH and other assessments. First of all, Lexidrug is the new version, the new name for Lexicomp. It just rebranded recently. It's our program's evidence-based drug reference resource. It's available for all team members that have the @NSM SGS email, and it's certainly more reliable than other resources you might look to like Google or WebMD. It is based in the US, so a little bit of caution around looking at indications or products. Just make sure you're looking at the Canadian version, and it does usually list the difference. So for basics, first of all, there's a PDF about how to install Lexidrugs on your NSM SGS phone. And via the web browser, you go to the Lexidrug website and enter this username and password. It does occasionally change, so if there is an update from Waypoint, the new sign-in will be shared. I'm just going to quickly show you a couple tips about this. So you just put in the username and password and sign in. Once you're on this website, you can actually save it as a bookmark, so you can go there. The other trick I wanted to show you guys is that if you click right here beside the name, click it and pull it over, it actually creates a link to that page. So you can have a link on your homepage for your reference. So going back to our presentation for a minute. Lexidrug facilitates a BPMH a couple different ways. You can use it to confirm drug name spelling, looking at the correct dosing or frequency. As well as in a more thorough medication assessment, you can look at regular dosing and frequency usage. You can look for medication onset and half-life information, adverse effects that you can expect with medications. You can check interactions and review general drug comparison charts. I am going to go through some scenarios now just to show you kind of how to do those things in more detail. So you're doing a BPMH and identify that a client is taking a medication that you don't know much about. So carbamazepine, 200 milligrams twice a day. You wonder if this or their other medication, amlodipine, could be causing falls in your older adult patient. So we're going to use this opportunity to look up a couple of different things. So first of all, when you log in, this is where you search for a drug. So I'm going to put carbamazepine. You start to type and it autofills. So if you're not sure how to type it, that's one of the ways to figure out how to find it. When you click on it, you just pick the Lexidrug option and it gives you the most information. And then you can either use the outline on the left or just scroll down in the middle and it scrolls automatically on the left if so. It gives you the brand name as well as the generic name. There is some dosing guidance here as well as specific indications. So if they were on carbamazepine for neuropathic pain, this would be where you would see their 200 milligrams in 2 to 4 divided doses. So your 200 twice a day seems reasonable. However, so you know that the dose that they're on is reasonable and the neuropathic pain makes sense, but is it contributing to their falls? So you can actually scroll down on the left-hand side here to the adverse effects section. The most significant adverse effects are at the top here, but then beyond that, you can see the ones that are less common and don't have as much detail around them are further listed there. The other thing you can do is click Control F, holding Control down and then F, and it actually allows you to find it. So you can put fall, and it actually pulls up details around falls. So carbamazepine is identified in this specific criteria as a potentially inappropriate medication in adults over 65 because of their risk of falls. So it kind of helps you to understand that, yes, this could be contributing to the risk of falls. And just to help with maneuvering a little bit more, the other one we talked about was amlodipine. So if you're in a monograph, you can actually search from the top, select amlodipine. As you can see, there's other things here. There's pediatric and other details, patient information. I tend to try to pick just the plain monograph. And like I did before, you can scroll down to the adverse effects or just actually Control Find and type fall in. And it does show older adult considerations here that there's a higher risk of falls in older adults. I do want to know about the side effects though. So you can actually click next and it shows you in other details, in other component parts there that there's also falls. So you can actually just keep searching. It doesn't actually show up, it looks like, in the adverse effects section, but it does talk about other things that you may be worried about related to falls. So whereas I went down here at adverse effects, cardiovascular, you can get edema, you can also get palpitations and syncope. So potentially related to falls there. Different ways to look. So we're going to head back for a minute to our presentation. The next scenario, you're embarrassed because you don't know how to pronounce some of the names your medication is on for a patient you're presenting it round. So if they're on bupropion, which for the most part we're okay about, and empagliflozin. So if you go back to the Lexidrugs main page, or even at the top of the other page, you can start to type the EMPA and it pulls up. And if you go to the monograph, there's actually up here, I don't have the sound turned on, but if you click this, it actually tells you how to pronounce that empagliflozin. So there's pronunciation for any drug names if you're ever curious about that. Back to our scenarios, you're concerned because you think the dose of quetiapine for behaviors may be too high for your older adult patient. So how are we going to look that up related to older adults? Going back to Lexi, quetiapine dosing. So we're going to click the, anywhere here you'll get the monograph, but I'm going to click dosing because I actually want to know a bit more about dosing, and it just takes me right to that section. So in general, in agitation or psychosis associated with dementia, you can look the dosing for immediate relief is 25 milligrams up to 75 twice a day. So that can help you to understand if it's appropriate or not. I do want to highlight over on this left-hand side, it also has that older adult dosing. And so they do say to avoid for BPSD unless non-pharm options have failed. And if needed, use the lowest effective dose. So for all indications, really, it says, dosage is in the lower end of the range are recommended, and to titrate slowly and monitor carefully. If there was specific dosage recommendations in older adults, it would also be listed here. So it's some different ways to figure out in our older adult population the right way to approach that. Back to our scenario, you want to look up side effects of antipsychotics. So I wanted to show this really cool tool. Along this line here, you can go to more clinical tools and indexes. And there's special charts and topics on the left-hand side. And it actually gives you a whole bunch of details. So I would look at things like the receptor profile for antipsychotics, but the one I think is going to be helpful for you guys are the comparison of antidepressant and antipsychotic side effects. So you could either search for that comparison of, and it will pop up. So comparison of antipsychotic side effects comes up. Or you can just go to that indexes page and you can pull up this chart. And it's great. It has all the side effects from akathisias and Parkinsonism, all the way to orthostatic hypotension, QT prolongation, and everything else that we look at for antipsychotics. And for example, aripiprazole, has kind of moderate to lower amounts of your akathisias, Parkinsonism, and lower for things like your orthostatic hypotension. But if you go down to, say, olanzapine, it's not that bad for this akathisia Parkinsonism, but a little bit higher for orthostatic hypotension and higher for things like weight gain or metabolic side effects. So this is a drug chart I use a lot, and I like it to compare the different antipsychotics. The last scenario that we're going to highlight some details is a prescription for quetiapine was just written for one of your patients who's also on carbamazepine, and you're wondering if that's okay. So back for our final check up here at the top, there's interactions. And the way you use this is you just enter the drug. So we're going to put quetiapine and carbamazepine, and you just select it, carbamazepine, there we go. And you can click add, or you just click on it and it comes up. And then I'm going to click Analyze. I just leave everything else the same. I don't use the allergy thing. I don't find it works as well. It explains the severity of the interactions up here with kind of what they mean. And then it does say for the drug interactions, it's a D level, so consider therapy modification. And if you click into here, it'll tell you a little bit more about it. So quetiapine dose increases as much as 5 times the regular dose are required to maintain therapeutic benefit, because the carbamazepine just really clears out the and really decreases the concentration of the quetiapine. So this level of detail isn't always necessary and may just be for your interest, but this is what I use often to check interactions, and may be interesting, especially if you have a new medication being added and aren't sure if there's going to be side effects or additive effects because of that. So those are our scenarios, and I hope that helps with using Lexicomp a little bit. Thank you very much for attending today.